Hello, my name is Luke Woolnough and my student number is 250521111. I'll be doing my case study on Raafe Baker discussing a strength-based care plan for him. A strength-based care plan is an approach which is described by Laurie and Bruce Gottlieb in 2017 in the Journal of Family Nursing as a philosophy and value-driven approach to guide clinicians, educators and managers to help foster a patient and family-centered approach to nursing. They describe this philosophy as being built on 8 strength-based values, which are health and healing, uniqueness, which is reflecting on the differences in assets, capacities, capabilities, skills, and talents, the person's strengths. Holism and embodiment, which is recognizing the connectiveness amongst the different parts to make a person whole and the integration of the mind and body. Subjective reality, recognizing the uniqueness of different lives and experiences and creating meaning through purpose and connecting with others. Person-centered integral, which is the recognizing the influence of other people, environments, and family. Self-determination, which involves choice and developing agency to make decisions. Learning with timing and readiness, which is looking at learning and education as an important aspect of survival and well-being. Appropriate timing and readiness to learn being important prerequisites for learning. And collaborative partnership, which is about the distribution of shared power from a person, their family, and the organizations involved in their care. So briefly summarized, the strength-based care for an older person, such as Raafe, is a philosophy using collaboration and empowerment for both healthcare provider and consumers to utilize their strengths and improve their physical, mental, social, and spiritual health in a holistic and person-centered way. The use of a strength-based approach on Raafe, we need to consider not just his health needs, but also his personal needs for him to age well and live a happy and fulfilled life. Before examining Raafe's health and social needs from a nursing perspective, I feel it's important that we look at his strengths, as it's a strength-based care. So first off, Raafe has lived alone for 40 years since his wife passing, and despite his health issues, he maintains pretty strong independence. At 70 years of age, he's still working in a business he co-owns. His history makes no mention of him using any services, and he still drives and catches public transport independently, which he quite enjoys. I feel Raafe's independence should be is vital to his sense of self-worth, and it's imperative that he's considered when developing his care plan. Now, while Raafe has several health issues, they're all pretty well controlled with medications. To me, this reads as Raafe having a good relationship with his GP and a reasonable level of health literacy. This means he can absorb information and is willing to learn about his health and make improvements. Learning being one of the important values of a strength-based care approach. And also, Raafe has a small but close-knit support network with his good relationship with his best friend Van and Vam's family, who involve him in family dues. Okay, so there are 2 key main issues I want to focus on in regards to Raafe care. Number 1, the most glaring one I think, is his obesity. And number 2 is his mental status and the risk he faces of social isolation and withdrawal. Raafe has a few health issues. So most notably, he's a type 2 diabetic. He has hypertension controlled and a family history of heart disease, with his brother dying of heart disease several years ago. All of these can be exacerbated or caused by his obesity. Raafe is 115 kilos and he's 170 centimeters tall, giving him a BMI of 39.8, which puts him at the extremely obese range in a BMI scale. This will require some significant lifestyle changes and assistance from a variety of different healthcare professionals in order to overcome. From a nursing perspective, we can give basic education on diet and lifestyle, and of course encouragement and empathy, but the most important would be referrals to allied health, namely a dietitian and exercise physiologist. So a dietitian's role is to provide advice for consumers in regards to diet and nutrition to maximize their health and well-being. A dietitian referral would help Raafe with some realistic goals in regards to what he eats, as well as providing important education on nutritional needs and calories. A dietitian could help write up a meal plan, and regular consultations could help maintain his consistency with that meal plan. This would have the bonus of keeping Raafe's diabetes under further control. Although it's controlled with medication, diet control would probably be better holistically, and help prevent any other weight or nutrition related issues he may face in the future as he gets older. Another member of the allied health team to work with Raafe in regards to his obesity would be an exercise physiologist. Their role is to give advice and education on exercise with the goal of injury prevention and management of chronic disease. An exercise physiologist could work with Raafe to develop a low-impact exercise regime and assist with weight loss, as well as reducing risks of exacerbating his cardiac conditions and diabetes. This would help him be more reliable, which is extremely important to promoting his independence. So the other issue we want to look at with Raafe is his mental state and his social isolation. Now, while Raafe has a good support network with his friend and business partner Van and his family, like I said before, they include him in their family outings and give him some sort of social outlet. He is at risk of becoming more socially isolated, particularly as he ages. Raafe's he's 70 years old, but as he gets older, and potentially loses mobility and independence, which is obviously what we're trying to avoid, he's at a huge risk of becoming more socially isolated. It's going to have massive effects on his mental and physical health. A clinical psychologist is one option to help Raafe with any concerns regarding depression or isolation, as well as developing strategies for combating feelings of depression or loneliness if he has them. Regular check-ins with the psychologist could also help maintain good mental health, the way that a regular GP visit would help with maintaining good physical health. As mentioned before, one of Raafe's biggest strengths is his independence, and I feel this could be capitalised through a relatively new initiative in Australia. It's been in the UK for several years and has been introduced, particularly in New South Wales, in the last year or two, which is called social prescribing, through a social worker or specialist nurse known as a link worker. So link workers are charged with facilitating and assessing individual health and social needs, while encouraging, planning, and referring to suitable community and volunteer groups to meet these needs. They'll act as a liaison between Raafe, community groups, and healthcare professionals. With this, Raafe could be encouraged and facilitated to join a social or volunteer group. Raafe currently lives in Rhodes and has access to a car and public transport. Like I said, extremely independent and mobile, despite only having one leg. So he would be assisted and encouraged into joining one of several volunteer. I think he'd be good at being assisted to join several volunteer dog walking groups that are in the inner west and city. This could give him a good amount of low impact exercise, obviously with consultation with his exercise physiologist. It would help him meet new people and develop a larger social network, which would reduce isolation, as well as give him some dog time. It was mentioned that Raafe has a fondness for dogs and couldn't have one in his third level apartment. With these nursing referrals and interventions, I think Raafe could maintain his independence, foster new relationships, and improve his health, which in turn could greatly improve his quality of life while utilizing his individual strength to live a full and fulfilling life. Thank you.